thank you all for coming. I want to get us started. This is the 3IE IFPRI joint seminar. I think this is the last one before we've been running for a calendar year. So we started in May 2012 actually with these. Today we are really pleased to have Markus Goldstein from the World Bank talking about empowering adolescent girls, evidence from a random RCT in Uganda. Markus is split between the Africa region and the Development Economics Research Group at the bank. And Clara Delavallade from IFPRI will be acting as a discussant. So Markus will give you about 45 minutes, and then we'll have a lot of question and answer afterwards. Thanks.
Cool. Thanks, Alan. Okay, so Alan already told you the title, so we can skip that. I have many co-authors. They're their names. Right? We can skip that too. So, and then that's the end of the paper. No. So just to give you some motivation, right? There's a lot of young people in developing countries, and particularly in sub-Saharan Africa. So, oops, I'm getting too excited. So here is the female population in Uganda compared to the developed countries, and you can see what I mean. That very much a very wide pyramid. So lots of youth. Motivation point number 2 is unemployment, such as it is measured in Uganda, not terribly high, but is higher particularly for younger women. So that's going to be a second piece of our motivation here, is that younger women tend to be more likely to be unemployed. The third piece of the motivation is fertility. That pyramid doesn't come from thin air, and here you can see fertility by age grouping in Uganda, again compared to the developed world. Again, just the point I want to make here is the concentration among that sort of 20 to 29-year-old age bracket. So we have this big bulk of young people, unemployment slightly higher among girls. And then I think for adolescent girls, these are compounded by health challenges. So issues of early marriage and sort of early childbearing, that's one factor. And the second factor is that this group, here, let's talk about 15 to 24-year-olds, that's where the HIV risk is the highest for females. Okay. So these two things, sort of this economic fertility and other health issues are tied together. You have this literature on teen pregnancy and motherhood leading to lower human capital accumulation, sort of changing the trajectory of earnings. You have the future labor market opportunities and investments in human capital from Jensen, and the risky behavior kind of things. Now, one thing where we fit in is that most of policy interventions you see out there either focus on HIV education and sort of some kind of HIV information, maybe behavior change intervention, or you get vocational training to improve labor market outcomes. And what you're going to see today is something where we put these together to tackle these with a multi-pronged intervention, which is going to be also, I guarantee, will be somewhat frustrating to some of you because we can't disentangle the effects. But I think that's worthy of discussion because there's a good policy answer for that. So the program I'm going to talk about today is run by an NGO called BRAC, which stands for Building Resources Across Communities. Originally it was a Bangladeshi NGO, but now it's global. And this is one of their first programs in Africa, at least for adolescents. And what it does is it establishes these community youth clubs for girls and then gives them some life skills training and some vocational training. I'll explain that all more in a in a minute. What we do is we randomize the rollout of this program at the community level, so randomized phase out, phase in, and then survey a bunch of girls 2 years apart. There's a 4-year end-line survey, which is just coming in now, but I'm just going to talk about the 2-year impacts. And those basically break down to labor market outcomes where we see a significant increase in labor. Yes? I'll make that clear. Very good question. There's a third treatment arm that I'm not talking about, or a second treatment arm that I'm not talking about today. So I'll show you a breakdown. It's just so that you want to read the next paper. That's, okay. So we find these labor market outcomes, and this is mostly driven by increased engagement in self-employment. We also find some pretty strong health outcomes. We definitely see improvements in HIV and pregnancy knowledge, which is important because the program focuses on that. And I will make an argument that this is suggestive of safer behavior, partially because we find a reduction in fertility that's fairly strong among the girls who participate relative to those who don't. And one of the strongest results, or the biggest results, I should say, is that these girls report a substantially lower rate of having sex against their will relative to the control girls. Then I'm also going to show you some opinions on gender roles and expectations on marriage and childbearing, and it'd be interesting to see what you think. I mean, this is the area of the paper. This is the area that's still the most under construction. So, you know, the argument here is this multi-pronged approach can really have a pretty sizable payoff for, and I'll show you at the end, for not a lot of money. Okay, so just quickly going through the literature, and you know, there's a lot of literature that sort of touches on this in a bunch of different areas. You have the HIV literature. A fair number of those sort of simple reproductive awareness programs don't show a significant impact. You see some, and here you see the Arkonda and Wanabe paper and the Dupas paper, certain kinds of interventions do seem to be showing some movement on the information education side on HIV risky behavior. Second is the vocational skills literature. Here, you know, this is at the bank, this is a perennial thing which makes the research guys very unpopular in the operational side, which is a lot of these programs have pretty weak impacts. Particularly when we talk about financial and entrepreneurship training programs. So business skills kind of stuff. There's a bunch of them. Well, you know, once in a while you'll see one that's significant. I think we need to understand what's going on there. But there's a lot, and we're doing a couple where it just doesn't work. Vocational training, I think you see much more of mixed evidence. You have this paper by Card in the Dominican Republic with some impacts. And then you have these active labor market policies, this paper by Galasso et al. In Argentina and Revenga et al. In Mexico. And the interesting thing, I think, for this paper here is that in both of those cases, there seemed to be some, at least definitely in the Argentina case, and Mexico it's a bit more of a mixed story. There's some evidence that women do better than men from these kind of programs, which if we think about gender differential constraints to engagement in the labor market, might make sense. So when we talk about multi-pronged programs here, the evidence is a lot less frequent, or there's a lot less of it. You know, in Kenya you have this weird result that if you combine the HIV awareness with school subsidies, you actually get lower impact, which I don't quite understand that, but that's what it is. And so what we're going to do is look at this combination of these two, and we'll compare it then back to some of these single-pronged interventions to benchmark those effects. Okay, so what I'm going to do is quickly run through the program then I'll answer your question about how we set up those treatment and control. Give you some sense of our data, and then the results and sort of conclusions. Okay, so the way this works is BRAC comes to the village, and they basically end up renting a room, which becomes a place for a girls' club. There's about 20 to 35 girls in each club, and it's only for girls. The official target age is 14 to 20, but we see no, the rule was not strictly, nobody checked, at least according to what they report in the household survey data. It definitely, most of them are in there. So there wasn't huge deviations, but it's not strictly enforced. And so the first thing they do, which I think, okay, and I'll talk a bit more about that in a second, because that's an interesting part that you don't see it as often. Then they do some life skills training, and then there's some financial literacy training which is done by mentors. These are girls who are identified within the club by BRAC, and trained by BRAC to give this training to their sort of peers. They're mentors, so they have a bit of more, they're of that cohort. And then there's livelihood training, which is sort of driven by what the local market conditions are. There is the program was designed with a heavy community support component, where there was supposed to be like a mother's committee and stuff like that. In practice, that, at least in the 2 years we're talking about, that really didn't happen that much. So I wouldn't really treat that as part of this intervention. And then there's microfinance, but I'm not going to talk about that today. So they're doing this program in Uganda. So as of August 2011, the program, they didn't wait for the evaluation results, had expanded to 48,000 girls in Uganda and Tanzania and South Sudan. We're also doing evaluations in those countries. And the results from Tanzania, which were just very preliminary, are very different. Okay, so the first piece is this clubs, right? And I think here the main thing is that it gives the girls a space to socialize. They do games, they do you go to these clubs, there's all kinds of sort of games and things to do. And when I asked the girls, where would you be if you weren't in this club, they're like, well, one of them actually just came out and said, well, we'd be hanging out with boys. The data would suggest that she's of the average, but anyhow, so it is a social space, and you just hang out with these girls, you see that there is a sort of strong network of support among the different girls. So it's open every day. The timing is after school. School, you'll see in the summary statistics, a lot of these girls are in school, but some of them aren't. So it's not a criteria for participation. But it's designed not to compete with school, and I'll show you results. It doesn't seem to compete with school. So the life skills and financial literacy part, one girl from each of these clubs is selected to be a mentor, as I said. And then they do this training, which covers everything from reproductive health through to legal knowledge. There's a little bit of leadership, child marriage, violence against women. It's a pretty wide-ranging. Then there's the vocational part, the livelihood training. This is provided by BRAC professional staff, and in the folks I'm talking about today, there were mainly 6 areas. So agriculture training, vegetable cultivation. Obviously, I'm talking about both rural and urban samples, so some of this is more relevant in one versus the other. Hairdressing, tailoring, and then sort of retail and small business. Okay. And so one of the things which may come up is that the training's diversified within a given club, right? So not everybody in one club is going to learn how to be a hairdresser. Okay. So microfinance is phased in. This is our second treatment, and I'm not going to say anything about it today, so let's skip it. So the evaluation strategy, BRAC chose what they call branches, which are sort of, I guess the health analogy is sort of catchment areas. And so 5 of these branches are in the semi-urban Kampala, sort of the outskirts of Kampala and Mukono, and then 5 branches in rural Uganda and Jinja. And so it's roughly about a 4-kilometer radius around these branch offices. The branches are defined by their microfinance operations, which were pre-existing. So within each of these 10 branches, 15 communities were identified as potential sites for the ELA program. And then within each branch, we randomly selected 10 communities to receive a club and 5 to be controls. So why did we do that? This helps answer that. You can see the timeline of activities. Basically, in the period I'm talking about now, we're going to have 100 treatment communities. And that's because after this first follow-up survey, so this is what I'm talking about today, is the results from the first follow-up survey, microfinance was offered to 50 of those 100 villages. So the idea here is to compare microfinance plus the clubs versus just the clubs alone, which was one of the questions BRAC really wanted to answer. Is that clear to everyone? So to collect our data, we did a listing of all the adolescent girls in the 150 communities. And from that, we sampled about, we sampled 40 girls, not about, we sampled 40 girls per community and surveyed them at baseline. This was 30% of the girls in the communities. It's a multi-module survey. The main focus is on life skills, sort of with a health knowledge component, but also things like self-confidence. Then a bunch of vocational skills. We did some financial literacy questions, a bit on analytical ability, and then sort of income generating activity. And then a whole bunch of things on education, time use, expenditures, expectations, and beliefs. We also interviewed the parents of these girls, but we're having a bit of problem with the parent data. I can talk about that later if somebody's interested. So for today, I'm just going to use the girl data. Okay. So Kelly, to come back to your question about what the average girl looks like anyhow. The average age in this sample is girls of 16. 70% of them are in school, and about 11% of them had children at baseline. Here you can see some of the. I mean, the other point from this is that we're pretty well balanced for treatment and control. And here you can see some of the summary stats on sort of this entrepreneurial ability, but also what they're doing in terms of earning income. So 2 years later, we went back. We found 4,888 of the girls. So we lost about 18% to follow-up. You look around at adolescent studies, this is not crazy attrition. I mean, if it was an ag survey, I'd be much more freaked out by that level of attrition. We do some work, and I'll show you a bit of it, to try and see if attrition's correlated with characteristics or with treatment status. We don't find anything there that particularly worries us. We've done some robustness checks for that on the estimation. We do find a bit that married girls are less likely to attrit in the treatment communities. Okay, so this is just looking at what's predicting attrition to back up what I was just saying. So compliance was something that we were particularly worried about at the beginning, and it's an issue we're actually having in Sudan. So the good news here is enough people actually went to the clubs in the community so that we can measure some impacts. The bad news is there's a bit of leakage because the club is not placed in the center of these communities. So, you know, it may be closer, in fact, to a given control household than it is to a treatment household. So you do see, I'm trying to remember if it's on this slide or the next slide, but you do see some of the girls in the control group actually participating in the club. So this is the second line here. You see about we see about 21% participation for the treatment girls, but we have 5% participation in the control areas. And as you can see here, you know, knowledge of these clubs is not zero at all in the control areas. Folks seem to go. This is not administrative data. That turned out to be a disaster. But from the survey, they a lot of them seem, or half of them seem to go 1 to 2 times a week. Yeah, let me moving here. Okay, so let me get to the estimation. So I'm going to show you a bunch of different estimates to just give you a sense for how it looks if we estimate it differently. We have internal differences on which ones we prefer, so we just put them all in the paper. With 6 authors, that's what happens. But I'll give you the difference in difference estimate as well as a first difference estimate. I'm not going to show you the TOT estimates. They're in the paper. We can discuss that later if you want. Okay, let's start with health knowledge and behaviors and agency, a bit of the agency effects. So here what we can see is an increase in HIV knowledge, sort of measured on answering questions correctly, and pregnancy, which is only coming off of 1 question, that seems to be significantly higher among the girls. And there seems to be a corresponding behavioral response with a reduction of 2.7 percentage points in the fraction of girls who have children. So putting that against the baseline mean of 10% of the girls having children. On the HIV side, self-reported condom use is higher. And you know, here I'll show you a puzzle in a second. So the story could be here that so what we see here is a movement from often or sometimes using a condom to always using a condom. And given the drop in fertility and the fact that they're not using other contraceptions, which you can see below, would suggest they're either using a condom or having less sex. But this STD results don't change. And this we're trying to unpack. Because we would expect that to also move. But I'm happy for suggestions and sort of discussions of that. And finally, the result here that I talked about earlier, which I think is really big, is this reduction in sex against their will, which is 16 percentage points lower against a baseline of 21%. This is in the last year recall. Okay, so that's the sort of health and a bit of the agency side. And on the economic side, what we're seeing is a significant increase that any of them are engaged in any income-generating activity. This is driven by self-employment. We have a colleague who's doing a similar program for adolescent girls, but it's much more of a traditional training program. In Liberia, she's also seeing most of the effects being driven by self-employment versus wage employment. So the income stuff, I think, is a lot more problematic. I think the data is a lot noisier. If we do a TOBIT, we get positive impacts on income, right? But the OLS is giving us, I don't know what it's giving us. But what's interesting here in terms of thinking about income is this last row of results, which is expenditure on goods in the last month by the girl for the girl. So these are things that she herself consumes. airtime, hairdressing consumptions, things like that. And here we're seeing pretty big positive impacts. So they're definitely spending more money on themselves when they're part of these clubs. Sorry? That, I would suggest that if our income results were stronger. But I think that's what's going on, but I can't prove it. And the club's not giving them these things, so they're definitely getting more disposable income from somewhere. But, I mean, you could, given our income results, you could argue there was some kind of substitution in the household that we're not observing. We can't rule it out. But there is this increase in engagement in income generating activities, and then you see this consumption change. So yes, I would argue it's suggestive, but I think you could make other arguments that I was included. Okay, impacts on schooling. So this is something Brack was worried about, was the girls dropping out of school because the clubs were driving them to work kind of thing. We're not seeing any impacts on that. Enrollment's pretty close to, the changes in enrollment are pretty close to zero. It's interesting here because if you look at the bottom row, in some specifications we are getting an increased intention to go back to school among the dropouts, but they're clearly not doing it within a 2-year period. So we'll see what the 4-year results bring on that. Okay, now instead of a table we'll get, we had a little fun with the graphs. So here we're looking at self-assessed entrepreneurship skills, confidence or skills. And any deviation from that inner black circle is a positive effect. The red line is our coefficient estimates, and the blue line is the blue dashed line is the confidence interval. And so what you're seeing here is these girls feel a lot better about their entrepreneurship skills, whether it's running their business, which is up on top, identifying business opportunities, but also protecting assets, bargaining over outputs and inputs as well. So they feel like they're better business people. They're acting like they feel like they're better business people as well. We also asked about life satisfaction. I think this is interesting given what the program's doing. So here you can see there's a bunch of results that aren't significant. Education isn't different from zero. Life as a whole isn't different from zero. School isn't. But where we see positive impacts are in earnings, their job, and their friends, which are sort of all big parts of the club. Family doesn't move. So this is their satisfaction with earnings. Yeah. Yeah, this is life satisfaction stuff. Okay, so this is empowerment. Now this, again, it would be useful to get feedback on this. What we're defining as a positive impact here is when they say that this is a task in the household that should be shared by a man and a woman. Okay, the possible responses are men only, women only, or shared by a man and a woman. Okay, so any deviation from sex assignment to joint is regarded as a positive impact. That's not meant to be judgmental, but that's how we're defining it here. We shouldn't maybe not call it empowerment, call it jointness. Okay, but so the interesting thing here is that these girls they show deviations from the control group in terms of what they think their husband should be doing, pretty much. And they're more likely to say both a man and a woman should be earning money, maybe something on education, but then also in some of the household tasks like fetching water, you're seeing a positive impact, and taking care of the kids, at least with the feeding and bathing part. The homework they're more agnostic. So here are some results on aspirations. The anticipated age at marriage goes up by pretty close to a year, and be in line with some of the fertility results. There's a bit here on who should choose the husband, and there seems to be some movement towards the self choosing it with the parents, and that we still have to unpack in terms of what the norms are that that are guiding the underlying behavior that's changing here. Suitable age for a woman in terms of more abstract things also goes up both on the female and male side. Maybe some reduction in the advantages of early marriage, and then who should choose the husband as well. It seems to be moving. In terms of childbearing, maybe there's an increase in the age of first birth. There is a decrease in the preferred number of children, and a little bit of movement in the preferred gender ratio, which in the male direction, but yeah, maybe small. Then there seems to be a bit of intergenerational aspirational movement going on here, that they're seeing higher age of marriage for their daughters, which I don't think is statistically different from theirs, but it's going up. And some aspirations on the future of both their daughters and sons increasing. We look for heterogeneity, both by the rural-urban, the initial household wealth, and the age distribution. There's a bit of heterogeneity going on there, but the results aren't clearly driven by any of these subgroups along these dimensions. There does appear to be somewhat higher impact for girls from poorer households, which may suggest inequality reducing element here. So cost benefit. Yeah, okay, it's not difficult. It's not easy because of the multiple outcome spaces we're looking at. So what I'm going to do at this point, we're still trying to figure this part out, is just give you the costs and the benefits and let you do the math. So I think, the running costs as of year 2 are $18 per girl, and this is ITT girls, so so you can compare it with the ITT estimates. So it's $18 per eligible girl. Just to put this in context, this is 0.5% of household income at baseline, and it's 21% of this annual per capita expenditure of what the girls are spending on themselves. So it isn't. If you were to charge for this, it might be that the girls could fund it themselves, or at least some of them, the ones who are working. Against this, we have our reduction in fertility. We have the increase in employment and the drop in the sex against their will. So sort of, you can't just add those up because there's clearly double counting if you do that. Take your pick, and then you have your costs. But to compare it to other programs, I think you see not dissimilar movements in some of these measures, but you see much higher costs. I mean, the thing that blows me away about this program, and just BRAC in general, is that it's very cheap. And so here you see the earnings and impacts in Colombia and in northern Uganda, but again, these are higher. And even if you look at sort of like Osler's conditional cash transfer, Baird and Osler's conditional cash transfers in Malawi, that would be more expensive for even some of the health impacts, I think. So just to wrap up, we're showing you these impacts of of BRAC's Empowering Adolescents program. Higher HIV knowledge, condom use, lower fertility, increase in labor force participation, driven by self-employment, but we're also seeing that consumption increase, lower desired fertility and early marriage in the aspiration space, and no impact on schooling. So, the argument I'd make here is that if you combine these things in an effective way, because even within BRAC, I think there's variation in the impacts of this, you can get pretty decent payoffs. And so, as I said earlier, we're currently trying this in a couple of, we're evaluating this in Tanzania and South Sudan as well to see what kind of external validity we have here. And we'll soon have these long-term impacts on the indicators I showed you, plus the impacts of microfinance. Thanks.